Hi, nurses, welcome back. So today we're going to focus on one of the most critical and yet often underestimated body system in NCLEX, and that is the renal system. So here's the NCLEX style question. A client with end-stage renal disease receiving hemodialysis is admitted with muscle weakness, confusion, and cardiac dysrhythmias. The nurse reviewed the lab result. Sodium is 138, potassium is 6.8, calcium 8.9, BUN is 70, creatinine is 7.6. Which physician's order should the nurse implement first? So the option A. Administer sodium polystyrene sulfonate or kexylate orally. B. Place the client on a cardiac monitor. C. Administer IV calcium gluconate as ordered. D. Prepare the client for scheduled hemodialysis. Okay, guys, so kindly pause the video and try to answer. Put your answer on the comment sections. Okay, so the correct answer is B. Place the patient on a cardiac monitor. Okay, so let's unpack this together like we're in a nurse's station reviewing the scenario before walking into the patient room. Why B is the correct answer? So when the patient has serum potassium of 6.8, they are in a severe hyperkalemia, which puts them in a high immediate risk for fatal cardiac dysrhythmias like ventricular fibrillation and asystole. So before anything else, we need to put the patient in a cardiac monitor to detect and respond to arrhythmias immediately. So remember, we can treat what we are not watching. So this is a safety first intervention, a key NCLEX priority principle. So we need to remember like this, what will kill my patient fastest? So in this case, heart arrhythmias due to high in potassium. Okay, so why the other option are incorrect? So let's discuss the rationale. Okay, so A, administer sodium polystyrene sulfonate or kexylate orally. So yes, eventually this is needed, but not first, because kexylate works by binding the potassium in the gut and excreted through stool. So that this process take hours, so the patient could arrest before start working. Okay, so C, administer IV calcium gluconate as ordered. Yes, this is also important, but it doesn't act fast. The calcium gluconate works by stabilizing the cardiac membrane against the effect of high potassium. But you still need to monitor the heart first to even recognize that it's already unstable. Okay, in my reference, in the practice, you'd likely to give this shortly after the monitoring is started. So the monitoring comes first as per NCLEX prioritization. Okay, so D, prepare the client for scheduled hemodialysis. Yes, dialysis is definitely a treatment for ESRD and remove the potassium efficiently. But the preparation like access, transport, team coordination, it will take hours. Yeah, sorry, it will take time. And again, we need to watch the heart first because if the heart stops, the dialysis won't matter. Oh, guys, in my notes with severe hyperkalemia, that's immediate cardiac threat. So we're not wrong by giving the calcium gluconate, dialysis, or kexylate, but it's a matter of prioritizations. Because if we want watch the heart, we won't know how the patient responding or crashing. Okay, guys, so NCLEX tip when the potassium is high and there's symptoms like muscle weakness and confusion show up, so cardiac monitoring is not optional. So it's a life. Thank you guys for staying engaged and studying with me. For more content like this, please follow my page.